Hello, welcome. Let's continue to talk about this question. As you can read, a 62-year-old man presents with a new onset of dyspnea and wheezing. So the dyspnea means out of breath, we cannot breathe smoothly. Wheezing is that cannot catch up with breath. I think it's a little bit associated with heart disease or pulmonary or lung disease, right? And he also reports facial flushing and diarrhea. So the facial flushing and diarrhea is strongly indicated that associated with carcinoid syndrome, right? Carcinoid syndrome. So generally, carcinoid syndrome is associated with the serotonin, right? Serotonin. That is secreted from the endocrine tumor, right? Endocrine tumor. And serotonin is just one of the substances secreted from the neuroendocrine cells, such as gastrin, substance P or VIP, vasoactive intestinal peptide, are all the substances secreted from the neuroendocrines. So then the patients will suffer from the diarrhea. And flushing is just because the serotonin can expand the blood vessel, so the capillary of the face will be expanded and then present the flushing face. And see that abdominal CT scan shows mass lesion in the upper liver lobe and appendix. So if according to the CT scan, we can see that there's probably the carcinoid tumor has been metastasized to liver, right? So the hepatic metastasis will present the patient with facial flushing and diarrhea, because you see that if there is no such a liver metastasis, maybe most of the carcinoid tumor will not present the facial flushing clinical manifestation, right? And so then which of the following medications can be used to relieve the patient's symptoms prior to the surgery? Well, let's just analyze one by one, okay? Why don't we just erase them for the next writing, okay? Just wait a minute. And the first pharmaceutical agent is desmopressin. What desmopressin is another vasopressin, right? Which is used for diabetes insipidus, right? Diabetes insipidus. So diabetes insipidus, the patients cannot control his urine just because the pituitary has been injured. And also vasopressin or desmopressin can be used to enuresis. So enuresis is generally can be found for the little boy, little girl, and generally under 10 years old will have the bed waiting during the evening, and then he or she cannot control his urine during sleeping, right? So, and then the desmopressin or as a vasopressin can control the filtration of the capillary glomerulus of the kidney, and then in this way can prevent the patients from urine, right? So, but this desmopressin is not for this patient with the clinical manifestation carcinoid syndrome, right? So I think desmopressin is out. Okay, and then let's just press them again. And second one is leuprolide. Okay, so leuprolide is the sympathetic, like a synthetic analog of the GnRH. Okay, and then GnRH is gonadotropin releasing hormone, and then the administration of the GnRH or leuprolide can suppress the pituitary releasing of GnRH, and then it can be used to treat prostatic cancer. Okay, and also can be used to the precocious puberty. As well as the endometriosis. Okay, for the lady got the endometriosis, cannot be pregnant. So I think that leuprolide is not also for this patient, right? With carcinoid syndrome. And the choice C, let's see choice C. Choice C is octreotide, right? Octreotide is the somatostatin. Somatostatin analog, right? It's a somatostatin analog. As we know that somatostatin is one of the substances secreted by the neuroendocrine cells that along with other substances such as substance P or VIP, vaso active intestinal peptides, and then the patient will have the diarrhea, right? And then so somatostatin, it's a correct choice because you see that can suppress the releasing of the somatostatin. That is can be used to treat the carcinoid syndrome, right? And then you see that the C of octreotide is the right choice because the carcinoid syndrome may accompany the extra-intestinal metastasis of gastrointestinal carcinoids. So octreotide is a synthetic somatostatin analog and used to control the symptoms of the carcinoid syndrome. So C is the correct answer, right? C is correct answer. But let's just continue to talk about the rest of three drugs. Choice D, finasteride. Well, finasteride is kind of anti-androgen, right? Anti-androgen. Androgen is the male hormone, right? Secreted by testis, right? And then C, it can be used for the prostatic hyperplasia or BPH, benign prostatic hyperplasia, because it can, the finasteride as an anti-androgen can inhibit 5-alpha reductase. So in the end, it will decrease the formation of the DHT, okay, dihydrogen testosterone, okay, dihydrogen testosterone, DTH. But this is not for the prostate, but the carcinoid syndrome. So D is out. E, ondansetron. Ondansetron is the anti-emetic. Anti-emetic is an agent that can prevent vomiting, nausea, and vomiting for the cancer or carcinoma, malignant, especially malignant cancer patients during their chemotherapy, right? During their chemotherapy, right? So this is not a cancer patient, so ondansetron is not right choice. Last one, flutamide. Flutamide is used to treat the prostate cancer. You can treat this flutamide can choose the prostate cancer, right? Prostate cancer, because it is inhibit the androgen, right? Inhibit androgen, or it is a competitive androgen inhibitor for the treatment of the prostate cancer. So for this question, the choice C, octreotide, is the right choice. So that's for today's video. Thanks for watching. Bye.